Thank you.
Thank you so much, Gwen, for that introduction. And thank you so much to the Share Queen Support Group for inviting me this evening. I'm so excited to share some tips and suggestions with you on enhancing flexibility, gaining strength, and basically empowering yourselves, empowering your healing and your wellness. I do have a PowerPoint that I will be sharing with you. With that, I will put everyone on mute. Certainly, if you need to unmute yourself, please feel free to do so. That way, we don't get that feedback. And of course, always feel free to write in the chat. I may not see it right away, but I know we have Victoria and Gwen monitoring the chat, so if I miss a question, I'll get to it. Without further ado, I'm going to go ahead and share my screen. Okay, so this presentation really is about you taking charge of your health. A growing number of research trials show that if you've been diagnosed with breast cancer, exercise is one factor within your control that can make a real difference to your life. Exercise has been shown to help improve long-term survivor, decrease the chance of breast cancer relapse, and minimize treatment-induced fatigue, as well as minimize bone loss and muscle wasting. What's more, it can help you regain your flexibility, your strength and endurance, and boost your quality of life. You might be asking, I mean, many of you are longtime survivors, but there are some of you that have just been recently diagnosed. When do you start? Well, it's recommended that you start on an exercise program as close to the moment as your diagnosis as possible, or you continue with your current program so you can reap all the benefits that I've mentioned above and more that I will be sharing with you. We know that the side effects of breast cancer treatment can make it difficult or impossible to be physically active on any given day. Exercise can ease the side effects of treatment, such as weight gain, osteoporosis, fatigue, pain from surgery, pain from reconstruction surgery, limited range of motion in the joints, specifically in the shoulder joints, right, for cancer survivors, the effects of lymphedema, and neuropathy. So lymphedema is swelling of the soft tissue in the extremities. It can occur in the breast, in the arms, in the legs. Neuropathy is nerve damage. So addressing the side effect of weight gain. During chemotherapy, a woman may experience weight gain, a decrease in lean muscle mass, and accelerated bone loss. Studies show that 50% or more of women receiving chemotherapy gain weight, usually between 5 to 15 pounds. Fatigue, a common side effect, can make it hard to start or maintain an exercise program, but we know that exercise can actually help ease some common side effects of chemo. Now, we know that muscles burn calories twice as efficiently as fat. So during chemotherapy, muscle mass typically shrinks while the fat tissue increases. This is called sarcopenia, and this means that your body burns fewer calories than it otherwise might. A woman who undergoes permanent chemotherapy-induced menopause can lose 5 years worth of bone mass in a single year. And even women who did not experience premature menopause also had accelerated bone loss. And here on this slide, you see an example of a healthy bone and one that has osteoporosis. And cancer or even cancer treatment affects your bones because breast cancer cells may speed the loss of calcium from your bones, as well as hinder the integration of calcium into the bones. Now we know that exercise and diet can help you maintain your bone density at the three most common fracture sites, your spine, your hips, and your wrists. Also, you can help yourself with daily calcium and vitamin D supplements, and possibly other medications can help. Also, weight-bearing activities like strength training, walking that stresses the bone, and balance exercises can help reduce falls that can lead to fractures. So we know that one of the most common complaints of women undergoing chemotherapy and radiation is fatigue. And that just makes sense. Our body is trying to heal. It makes sense that our body's energy is focused on the healing. Now, according to the National Cancer Institute, light to moderate walking or other activities may boost energy, mood, and even a faltering appetite. Now, accumulating activity gradually over the day and paying attention to the time spent is more important than focusing on the intensity of the activity. In other words, you don't have to be doing a boot camp type of workout. It can be simply, like I mentioned before, something as easy as walking, yoga, tai chi, and certainly, there are many other factors that can contribute to fatigue. There's anemia, depression, poor appetite, thyroid deficiency, dehydration. So, really, getting even a little bit of exercise is always better than doing nothing. We know that pain from the incision site and spasm of the pectoral muscles on the chest wall may make moving your shoulder uncomfortable. This can even cause what's called protective posturing, where your head tilt forward, your shoulders rise and tilt forward also, and your elbows are flexed so your hands rest across the abdomen. Makes perfect sense, right? Almost taking a protective, almost fetal-like positioning of the body. Now we know that a mastectomy can cause tightness along the front of your chest where the skin has been sewn together snugly, and scar tissue forms as the chest wall skin finds a new home against the pectoral muscles. So extending your arm to reach for something will hurt enough to make you use your shoulder less. And what happens when you use your muscles less? This shortens the chest muscles, which further restricts shoulder mobility. Now, particularly with lymph node surgery under the arm, a mastectomy, or even reconstructive surgery, scarring can cause what's known as cording, which means that the underarm muscle tendons or larger lymphatic channels become stuck to the undersurface of the skin as scar tissue forms at the surgical site. So what can you do? Well, stretching plus physical therapy massage of the surgical site helps to break down scar tissue and can help you restore your full range of motion. Now, once you have done so, you can safely start a program of strength training exercises for the arm that will help you recoup lost strength lost after a period of disuse. So first, you stretch the muscles, begin to get more mobility in the area, more range of motion, and only then do you start a strength training program. Now, it's recommended that you discuss with your surgeon the safest time to start exercising, usually anywhere between 3 to 6 weeks. Now, strength training can also help you balance the strength between your front and the back of the body by building up the chest muscles, the pectoralis, the anterior deltoids, and here you see on the screen, here you can see the pectoralis major, right here labeled right here, pectoralis minor, which is underneath the pectoralis major, deltoids in front. I find it's helpful sometimes to even envision those muscles. Knowing where they are, I feel empowers us. We understand our body better. We know we're doing something for our body. So that's those are the muscles to focus on in the front of the chest. Now the back muscles. Here we see the trapezius, the rhomboids, posterior deltoids, teres major and minor. And here I'll point them out. The trapezius, actually, there are three muscles, the upper, middle, and trapezius. See, you see here in this kind of square-like muscle, the anterior deltoids, you see the back, so it's the back of that shoulder. Rhomboids are underneath, teres minor and teres major also underneath these bigger superficial muscles. Now, sometimes radiation can cause costochondritis, an inflammation of the ribs that may trigger pain during exercise involving the chest muscles. Radiation may also stiffen and shorten pectoral muscles, a condition known as fibrosis. Radiation to the underarm and the collarbone raises a woman's risk of developing lymphedema. And again, what can you do for this? Again, stretching, massage therapy can help loosen up muscle tightened by fibrosis. Your doctor may even suggest taking a non-steroidal anti-inflammatory drug such as ibuprofen for a few weeks to relieve the pain and quell inflammation. So I would, well, I don't advise, but all the investigations advise that if you receive radiation to the underarm, to be especially cautious when you're doing strength training to minimize the chances of developing lymphedema. So movement can be healing. Being physic being physically active allows you to take control of your rehabilitation and help ease the side effects for a more complete and timely recovery. A comprehensive fitness program should include aerobic conditioning, balance exercises, stretching, and strength training. Now, walking is the #1 activity recommended for all cancer survivors, right? This weight-bearing aerobic activity helps guard against osteoporosis in the hips and legs while also tuning up your heart and lung. That's why it's known as aerobic conditioning. You are strengthening your heart and your lungs. In addition, regular walks also help build muscle mass and help you to control weight. Remember I mentioned earlier that muscle burns more calories? And again, you can start the day after surgery. The American College of Sports Medicine, known as ACSM, their cardiovascular guidelines for Cancer Survivors recommends a total of 20 to 30 minutes of walking 3 to 5 times a week at a moderate or slightly hard pace. So you should be able to talk, but maybe you can't sing. That's the pace you want where, maybe there's a light sweat happening. You can also meet this goal with shorter 5 to 10-minute walks, resting after each if necessary. Now, you may want to aim to start with for 3,000 steps a day. If you have your phone can track your steps. If you have an iWatch, that can also track your step actually, and there's also many other devices. A pedometer can also track your steps a day. You can start with a goal of 3,000 steps, which translates to approximately 30 minutes of movement. Now, 1 mile equals roughly 2,000 steps. Now, the American College for Sports Medicine recommends that you slowly build up to 10,000 steps a day. That's approximately almost 5 miles, and it does sound like a lot, but again, you can begin small and slowly build up. Now, as I mentioned, right, you need an exercise program that has aerobic training, but also balance training. Balance is very important at any age, especially if you are at a risk for osteoporosis. Surgery and breast reconstruction can cause the skin tightness, it can cause muscle imbalances and body strength asymmetry, right? One side of the body may be stronger than the other, which can alter your posture and your balance. Chemotherapy and other medications may contribute to balance problems too. Fatigue can also diminished alertness and poor concentration can impair judgment and may increase the likelihood of falls. So a fall combined with a loss of bone density increases the risk of fractures again in the wrists and the hips and the spine. And according to the National Osteoporosis Foundation, 1 in 2 women over the age of 50 will have a osteoporosis related fracture in her lifetime. So what can you do? Balance training, and there on the screen you see a women in balance training. We're going to try some of these. They're on the slide because I believe you will receive a copy of this slide deck. So I'll save us trying to do them after my little presentation. These are other balance exercise, a single leg stance. What are the benefits? Helps you to improve balance and control by strengthening the supporting leg and hip on which you are standing. Heel raises are also a great balance exercise. They strengthen the gastrocnemius, the muscle that runs down the back of the lower leg. And here on the screen, you see the gastrocnemius. In addition, you also see the soleus. And this particular muscle helps you improve your stability. Now, after breast surgery, patients often experience body stiffness, postural changes stemming from skin tightness and muscle imbalances, and a decreased range of motion at their joints. And again, specifically in the shoulder joints, but very often also in the hip joints due to not just the surgery, but also due to the different medications. In addition, inactivity and holding the body in an awkward position. Remember the posturing I talked to you about? Right? You're in this awkward position to avoid pain, and that can shorten and tighten the muscles and tendons. Now, stretching is the key to regaining flexibility and the first step in alleviating these side effects. Again, wait 3 to 6 weeks if you have had reconstructive surgery to stretch. You can still walk, but maybe you don't want to stretch. Otherwise, it's It's usually safe to begin after your post-operative check once all the drains have been removed and always with the approval from your surgeon. Now, again, American College for Sports Medicine suggests that everyone stretches at least 3 days a week. After surgery, it's recommended to stretch daily to help you recover more quickly and fully. They recommend performing each exercise 3 to 5 times, holding each stretch for about 5 to 30 seconds, and over time, work up to 20 to 30 seconds to optimize the stretch. Now, when you're doing the stretch correctly, it should never be painful. If you do feel pain, you stop. You've gone too far or your position is incorrect. Now, pushing a stretch too far or bouncing activates what's known as the stretch reflex. It's a mechanism in your muscles that they use to protect themselves. Think of your muscles like a rubber band that you feel pulling back into its original shape. If you stretch a rubber band too far, it can snap and break. When muscle fibers are overstretched, a nerve reflex tells your muscles to contract to prevent them from being injured. And this can cause pain and damage the fibers, which increases soreness and scar tissue formation. So to be avoided, you want to make sure your muscles are warm before you begin stretching. Think of your muscles like bubble gum, right? Plan to spend about 5 to 10 minutes warming up with an aerobic activity, right? Fast walking, jogging in place before stretching, or stretch at the end of other activities, including housework, right? I know sometimes I work up a sweat vacuuming my floor. Um, or take a warm shower if you're really feeling low in energy. It's important that you control stretches rather than bouncing or jerking, and slowly stretch the muscle just to the point of tightness and hold calmly 5 to 30 seconds while breathing smoothly and naturally. Sometimes I know in physical therapy, they might even use a stopwatch. They'll even time the length of a stretch. Now, once you feel comfortable, you try the stretch, you try to go a little further, although never to the point of pain. And don't ever strain to hold any pose. You advance at your own pace. Learn to listen to your body and follow your body's directions, no matter who is leading the exercise or telling you what to do. Always follow your own intuition. Now here on this slide, you see several different exercises. And again, we are going to try some of these. I put these in my slide deck so you will have them after my little workshop. But some of these may look familiar to some of you. We'll try some of these, lifting your arm above your head, beach pose. Here, let me circle it so you can see it. This beach pose is bringing the hands behind the head, and here you see the person. These can be performed lying down. Chest stretch where you're squeezing the shoulder blades together. Here you have walking the fingers up the wall. Bicep curl with a light weight, lifting your arm above your head sitting. And here you see this figure has a little can here. Can also use Dynabands for shoulder extension, Dynaband here for shoulder external rotation. Simply lifting your arms stretches your chest and bringing the arms back down. And I'm sure these are not new to any of you at all. Sometimes it's nice just to have them all in one place. So I mentioned this earlier. First, stretch the muscles. Now, once you can comfortably move to a fairly good range of motion for you, you can begin strength training. We know that when muscles are unused, they quickly lose their strength and begin to dwindle. In fact, people who do not exercise can expect to lose 30 to 40% of their strength by age 65. Surgery leaves many women with muscle imbalances and weaknesses that can hinder their ability to perform daily activity. Chemotherapy combined with post-surgery inactivity speeds muscle and bone loss and prompts fat gain and a lower metabolic rate. A strength training program can help erase many of these problems while allowing you to regain strength and abilities. So when can you begin strength training? When you have healed enough to start at about 4 to 8 weeks after surgery, but we know that recovery varies. Again, wait until all drains have been removed and you have regained a full upright posture and a complete and comfortable range of motion if you're in your joints, because prematurely starting a strength training can cause more injury. I mentioned these first 3 points. Now, other recommendations is that you select weights light enough to allow you to perform each exercise safely and with proper form and full controlled range of motion. Perform at least one full set of 8 to 10 repetitions. You should feel mildly fatigued by the end of the set of 8 to 10 repetitions. Again, the American College of Sports Medicine recommends performing 8 to 10 strength training exercises covering all the major muscle groups 2 to 3 times a week with a full day of rest between workouts. If you've had multiple lymph nodes removed, do strength training for the arms only twice a week rather than 3 times a week. Brief word about lymphedema and strength training. Again, if you've had the underarm lymph nodes removed, other than during a sentinel node biopsy, or have had radiation beneath the arm or around the collarbone, you need to approach rehabilitation very carefully. Just observe certain precautions during strength training. New thinking suggests that a gradual, progressive strength training program may minimize the risk of lymphedema by helping dilate or widen the remaining lymphatic channels around the shoulders. Now, these channels would be better able to handle the increase in the flow of lymph from the arm into the body prompted by exercise or a problem like an arm infection if necessary. So having that lymphatic fluid moving constantly is quite helpful. Years ago, doctors really believed that even a slight exertion of the arm would trigger lymphedema, but now we know that's not true. So you might, if you're not suffering from lymphedema, you may not know what it is, but lymphedema may appear soon after breast surgery or even months or years later. The greater number of lymph nodes removed and underarm radiation therapy raises the risk of lymphedema. Lymphedema is the swelling of the soft tissues of the arm, hand, trunk, or breast that may be accompanied by numbness, discomfort, and sometimes even infection. Tissues with lymphedema are at a high risk of infection. So what can you do besides exercise and move if you are at risk for lymphedema? Well, wear a full arm or hand compression sleeve during arm strengthening or training exercises. Exercises where the arm is used in repetitive movement, such as swimming, rowing, or racket sports, or more vigorous physical activities that may place, excuse me for that typo there, that may place stress on the arm, such as raking or scrubbing a large floor. How can you reduce the risk of lymphedema? Let your weaker side dictate the pace of strength training. Now, you may want to start weight training with no weight at all and just simply focus on proper body alignment and move slowly and steadily and purposefully. It's better to err on the side of safety by doing no more than 10 repetitions of an arm exercise per set, and also alternating between upper body exercises and core and leg exercises. It's also recommended that before doing a second set of all the exercises, rest for 1 to 2 minutes to allow the lymph fluid and the lactic acid to clear for the arm. Also, leave at least 2 days between strength training sessions and only do arm strength training twice a week if you're suffering or you're at risk for lymphedema. Here on this slide is just a visual of what lymphedema might look like. We have lymphs located throughout the body. Here we see what a healthy tissue looks like. You see here the lymph vessels. Here you see lymphedema where the lymph fluid is blocked, and that's what causes swelling. Now, we know that the lymphatic system is part of the circulatory system and an important part of our body's immune system. And here on this slide, you can see depicted the circulatory system. In other words, right, the blood, the red depicts the oxygenated blood leaving the heart, and the blue represents the blood returning, the deoxygenated blood returning back into the heart. And here you see the lymphatic system, right? Pretty much parallels the circulatory system. And at the very end here, you see the interrelationship between these two systems, where here you have the heart, right? Blood pumps out, moves into the capillary, the blood flows into the cells of the body with the lymph nodes. Lymph nodes might clean our blood of pathogens, viruses, etc., drains the lymph, and then the blood returns back to the heart, and the cycle begins again. So there are lymph nodes in many parts of the body, including under your arms, in your armpits, in each groin, at the top of your legs. In fact, that's where you see a concentration of them. And you can see here on this slide, right here, pelvic area, you see a lot more lymph nodes under the armpits. But as you see, there's also many around the head, even some behind the knee. You may be able to feel some of the lymph nodes, such as the lymph nodes in your neck. We know that these lymph nodes filter the lymph fluid as it passes through them, where white blood cells such as the B cells and T cells attack any bacteria or viruses they find in the lymph. And I'm going to show you when I'm done with the presentation how we can wake up our lymphatic system, like what movements we can do to get that lymph flowing faster. We know that when you exercise, your lymph flows about 15 times faster than when you're just sitting still. Now, we know that when cancer cells break away from a tumor, they sometimes can get stuck in one or more of the nearest lymph nodes. That's why doctors check the lymph nodes when they're working out how far a cancer has grown or spread. When lymph nodes are swollen, doctors often call this lymphadenopathy. And the most common cause is infection, but lymph nodes can become swollen also because of cancer. There are other lymphatic organs in the body, such as the spleen, the thymus, the tonsils, and the adenoids. The thymus gland, that's what I put here, is a small gland under your breastbone. It helps to produce white blood cells to fight infections, right? These blood cells that I talked about, the T cells. Most often, this gland is active in teenagers and begins to shrink with adulthood. So one thing I do in my Moving for Life class, we always end with a little thymus tapping, because this tapping begins to activate that lymph and wakes it up, because it tends to shrink, and it can even atrophy through to lack of proper stimulation, whether energetic stimulation or just movement in general. So as I mentioned before, the thymus produces the T lymphocytes and a hormone which stimulates the development of these T cells. So muscular activity, especially when initiated from the body extremities, is essential in maintaining the healthy flow of the lymph. The ends of the lymphatic vessels are extremely narrow, and the pumping action of the surrounding tissue helps to squeeze the fluid into and along these channels. So the types of movements that help move the lymph, any rhythmic squeezing of the periphery of the hands and feet. So right there, I know you're all sitting and you're listening to them, but why not get that lymph moving? How about squeeze your hands? How about squeeze your feet? Maybe do a little wiggling and jiggling. Also, any large stretching movement avoids pooling of the fluid. So right where you are, how about take a stretch right now? I can't really see all of you because my PowerPoint is blocking it. But even if you can't stretch your arms all the way up, stretch it as much as you can, any direction. Maybe even move the shoulders gently, roll them up to your ears and down. And again, we will do a little bit more moving once I'm done with the PowerPoint. Right now, I would just love to show you some of these visuals. Here on this slide, you see the direction of the lymph. These are directions that you can use. You will see later on, you can do some dry brushing. We'll learn how to get that lymphatic fluid moving in our bodies. So it's important to exercise, because exercise activates the lymph. It helps drain lymph out of the affected areas and eventually back into the bloodstream. So exercise is movement of the muscles and joints that act as a pump to increase the rate of the lymph flow up to 15 times above the resting rate. I said it before and I'll say it again. 15 times above the resting rate. So if you are uncomfortable because you're experiencing swelling, right, and it's counterintuitive because it hurts to move, but actually any sort of gentle movement will actually help alleviate the pain. So do any sort of gentle stretching, range of motion exercise where the muscles are contracting and relaxing, because this helps to push the lymph along, and at the same time it strengthens the lymphatic system. And I mentioned before, examples include making fists, extending the fingers, doing wrist circles, even gentle like punching motions. Anytime you're extending the elbow, right, you're contracting and expanding the muscles. Exercise is also part of the complete congestive therapy known as CDT program that manages the swelling of lymphedema. So if you suffer from lymphedema, again, it's helpful to wear your compression garment during exercise, except of course if you're exercising in water. Now, do not wear tight or restrictive clothing while exercising. For example, you should try to avoid tight bra strap or very tight underwear. Perform each exercise in a slow and controlled manner. If any exercise causes pain, decrease the number of repetition or do not perform that particular exercise again for several days, right? Give your body time to heal. Exercise moderately and avoid overuse of your affected limb as you gradually build up your strength and ability. So according to the National Lymphedema Networks, most women with lymphedema can exercise the affected arm or other body part safely, again, as long as they wear compression garment and do not exercise the arm or other affected body part to the point of fatigue. And they make appropriate modification to prevent trauma or overuse. Some more recommendations. If you have manual lymph drainage massage, rest between 20 to 30 minutes, or even after exercising, just rest. You may want to elevate the limb for 15 to 20 minutes. Deep abdominal breathing should always be included before and after every exercise program, because not only is it relaxing, when you're relaxed, you stimulate the flow of the lymph. Also, the lymph, like the entire human body, is made primarily of water. So stay hydrated. Drink plenty of water. We know that women who were diagnosed with lymphedema at the start of the PAL trial, PAL standing for Physical Activity and Lymphedema trial, who followed the weightlifting plan or any weightlifting plan, were 50% less likely to have the lymphedema get worse. So very light progressive lifting of heavier weights could be better than not exercising an arm at risk for lymphedema. And it helps you to improve your body image, and it also helps you lose fat. At Moving for Life, we teach the lymphatic movement sequence where we ask you, and I'll ask you to do it with me here, take a nice deep breath in as you expand the body. Exhale, come into a small ball-shaped position. Squeeze everything towards your center. Take a nice deep breath in where you are right now. Hold the breath, and then explode. Ha! Forcefully exhale, coming into a big position. And then from there, we do some shoulder rolls, but will go over this when you can see my full body. Again, it's on the slide so that you have access to it after my presentation. Another thing I recommend, you might say, well, there's so many exercise programs out there. I would recommend Moving for Life. And what makes our particular exercise program special? Well, first of all, it's gentle movement. It's intelligent exercise based in science. We have been part of several evidence-based trials. We offer fun and joyful dance sequences. We teach somatic awareness and self-care. We use uplifting music, and we provide a form of group support. And it can be very nonverbal. We usually don't share much other than we share movement together. Occasionally we do have some verbal sharing, but for the most part, since we've been online, that's the other plus, we're online, it's free. We offer classes 7 days a week, some days even twice a day. We also promote somatic awareness. The soma is a living body, the body that can be aware of itself. Body, mind, or somatic fitness specialists and Moving for Life instructors will always consider how to observe the needs of the whole body and the person while exercising. Somatic awareness is about listening to the emotional aspects of the physical experience. Also, we can tell you know where to move or touch or where not to move or touch. For example, I try not to use the word no when we are moving, but pressing your hands into your knee when you're trying to stretch your leg that's not a good thing to do because it can cause injury to the knee. I often ask people to place their hands on their upper thigh as an example of what not to move. And I always say, if you feel pain, please don't do it or modify the movement. So returning to our lymph discussion. The lymphatic system, again, is part of our immune system, is part of our circulatory system. It can become out of balance due to nutritional deficiency, a high intake of processed food, and a lack of physical activity. And here's a list of other health conditions which could suggest that your lymphatic system requires a serious cleansing. If you suffer from arthritis, skin condition, digestive disorders, frequent headaches, sinus infection, unexplained injuries, excess weight, or chronic fatigue. It can be a reason why you also are suffering from lymphedema, not only because you've had lymph nodes removed or you're in cancer treatment. Here are some ways to create more flow in your lymphatic system and remove toxins from your body. Number one is exercise. Also, alternative treatments like lymphatic drainage and massage. You can actually go to professionals that will perform a lymphatic massage. Hot and cold showers help. Dry brushing and always brushing in direction from the fingertips in towards your heart or your toes in towards the center of the body, drinking clean water, avoiding tight clothing, and as I mentioned before, breathing deeply. Again, movement can be thought of as medicine. I showed you, and I mentioned this before, activating the hands and feet, squeezing, even walking or any sort of rhythmic movement will help reinvigorate the lymph and move the excess fluid out of the affected area. So think of squeezing, think of stretching. Now, in addition to exercising, we know diet also plays an important role in keeping your lymphatic system healthy. And like everything else, eat foods that are good for you. And here I'm showing you some foods that are particularly good that will promote lymph flow. Leafy green vegetables, low sugar fruits, ground flax seeds, chia seeds, avocado, garlic, Brazil nuts, almonds, walnuts, cranberry. Now avoid foods that cause blockages to your lymphatic system like processed foods, conventionally raised meat, artificial sweeteners, conventional dairy, sugar, soy, and table salt. Drink herbal teas that stimulate lymph flow. You see them listed here. Or just lots more water. So in summary, perfect, I'm in good timing. If you've been diagnosed with breast cancer, exercise is one factor within your control that can make a real difference to your life. Exercise is part of a healthy lifestyle. It increases your energy level. It helps to burn more calories to maintain a healthy weight. It activates your lymphatic system, which boosts your immune system and increases your feeling of well-being. Bottom line, exercise improves your long-term survival. Part of the slide deck that you will be receiving is a video with our founder, Martha Eddy, showing you the lymphatic boosting workout. You'll have that for yourselves for later when you don't have me. Oops. Hi, I'm Martha Eddy from I will also show you some exercises. So anyway, that's kind of the end of my presentation. You can go to our website, list it here. Again, you'll have it in your slide For more information, to register for classes, or even to sign up for our monthly newsletter, you can email us at info@movingforlife for more, for any questions you may have. Also want to note that we have classes supported by Share on Tuesdays and Thursdays at 12 o'clock. But as I mentioned before, classes 7 days a week, and they are free online. We also have slowly started returning to in-person classes. And again, that is listed on our website. So I'm going